You know that feeling. When the seasons change, maybe spring hits, and suddenly your nose just won't stop running, or your eyes get super itchy.
Oh, yeah, absolutely.
Yeah.
Lots of people get that.
It's that pollen allergy thing, right? Hay fever, some call it.
Exactly. Allergic rhinitis is the more technical term. But yeah, hay fever, pollen allergies, it affects so many of us.
So today, we really want to dive into that, figure out what's going on, what causes it, maybe some quick fixes.
And some longer-term strategies, too. We want to unpack the science, but keep it easy to follow.
Right. And we've looked at some solid sources, Mayo Clinic, the AAI, folks who really know their stuff.
Yeah, reputable health organizations. We've distilled the key info to give you practical tips for navigating allergy season.
Okay, so let's start at the beginning. What is actually happening in the body with a pollen allergy?
Well, basically, it's your immune system kind of. Going into overdrive, it starts overreacting to things that are actually harmless.
Like pollen.
Exactly. Pollen from trees, grasses, weeds, these tiny particles floating around in the air. Your body mistakenly flags them as dangerous invaders.
So my body thinks a bit of tree dust is attacking me. That sounds a bit much.
It does seem that way, doesn't it? But that overreaction is precisely what triggers all those symptoms we associate with allergies.
Ah, the symptoms. Yeah, let's talk about those. Because it's not just one thing, is it?
No, not at all. The most common things people notice are, like you said, the runny nose, those really itchy eyes, feeling stuffed up, sneezing fits.
Oh, the sneezing.
And sinus pressure too, that feeling behind your face. But there's more.
Like what?
Watery red eyes are common. Sometimes a cough or an itchy feeling way back in your nose or the roof of your mouth, even your throat. And that annoying post-nasal drip where you feel stuff dripping down your throat. That can happen. Some people even get dark circles under their eyes.
Allergic shiners, I've heard them called.
That's the one. And just feeling wiped out, really fatigued. And how bad it gets varies a lot from person to person.
Wow, okay. So it really can mess up your day, huh? It's not just a minor inconvenience.
Definitely not. It can interfere with work, school, sleep, just your general quality of life. It can really take a toll.
Sometimes it feels like a cold or maybe something worse these days. It gets confusing.
That's a really important point. It's easy to mistake allergy symptoms for a common cold or a sinus infection or even COVID-19. They share some features.
So how do you tell them apart? I always wonder about that.
There are some key clues. Allergies usually hit you pretty fast right after you're exposed to the pollen.
Okay.
And the nasal discharge. It's typically clear and thin, watery. Plus, you usually don't get a fever with allergies. And they stick around as long as the pollen does.
Right, that makes sense.
Colds. Colds tend to come on a bit more gradually, maybe a day or two after you catch the virus. The mucus might start clear, but often gets thicker, maybe yellowish or greenish.
Yeah.
You might also get body aches, maybe a low fever. And colds usually clear up in about a week or so, maybe 10 days.
Okay. Sinus infections feel different though, right? More. Face pain.
Often, yes. With a sinus infection, you're more likely to have thick, discolored nasal discharge again, plus facial pain or pressure, maybe a headache, but itchy eyes. Usually not a feature of sinus infections, unlike allergies.
Interesting. And COVID?
Well, COVID can bring on coughing, runny nose, congestion, sure, but it often comes with fever, significant fatigue, sometimes a sore throat, body aches, and occasionally those GI symptoms like nausea or diarrhea, which you don't typically see with allergies.
So paying attention to how quickly it started, the nose situation.
Yep.
And whether there's a fever or body aches can help sort it out.
Exactly. Knowing the difference is key for treating it right, and knowing when maybe you should see a doctor, especially if you're not sure.
Okay, so my immune system is overreacting. What's the science bit? What's going on inside that makes me sneeze and itch?
Right, so this is where it gets fascinating. If you're allergic to pollen, your body produces these specific antibodies called IgE. Think of them as little scouts, specifically trained to recognize certain pollen types.
IgE. Okay. Pollen scouts. Got it.
So these IgE antibodies attach themselves to certain cells in your body, mainly mast cells. Now, the next time you breathe in that same pollen, the IgE antibodies on those cells recognize it, grab onto it, and basically signal the mast cells to release a flood of chemicals. And the big one is histamine.
Histamine. I know that name from allergy medicine boxes. So histamine is the bad guy here.
It's the main culprit for many symptoms, yeah. Histamine causes inflammation, the swelling, the itching. It makes your blood vessels leaky, leading to that runny nose and watery eyes.
Ah, so that's why antihistamines help. They stop the histamine.
Precisely. They work by blocking histamine from attaching to its receptors on cells, so it can't cause all that trouble.
It all connects. Okay. It's this whole chain reaction because my body got the wrong message about pollen.
You got it. It's a defense mechanism gone slightly haywire, unfortunately leading to discomfort for allergy sufferers.
Okay, understanding the why is helpful, but allergies definitely feel worse at certain times of the year. Is there like a pollen schedule?
There absolutely is. It follows the plant's reproductive cycles. We generally break it down into 3 main seasons, though it can overlap.
Okay, lay it on me. When do I need to brace myself?
First up is tree pollen. That tends to kick off early, usually early spring, sometimes even late winter in milder places. It runs through, say, May.
Which trees are we talking about?
Common ones are oak, birch, cedar, maple, pine. But also mulberry, alder, hazel, willow can be troublemakers.
So just as things start looking green and hopeful, boom,
Right.
allergies.
Often, yeah. Then, moving into late spring and summer, we hit grass pollen season.
Ah, lawn mowing season.
Exactly. Peak is often April through early June, but in warmer climates, it can be almost year-round. Think Kentucky bluegrass, Bermuda, ryegrass, timothy grass.
Gotcha. And after summer?
That's weed pollen time, late summer through fall. The big one for many people is ragweed, which usually peaks around early to mid-September.
Ragweed gets a bad rap.
It does, for good reason. But other weeds like burning bush, cockleburs, sagebrush, tumbleweed also contribute.
So it's like a year-round relay race for pollen.
Kind of, but, and this is important, the timing and the main players really depend on where you live.
Right. You mentioned cedar fever earlier. That's a location-specific thing.
Exactly. That's a big issue in parts of the South and Southwest during the winter due to mountain cedar pollen. So, knowing your local pollen calendar is super useful for anticipating when your symptoms might flare up.
That makes total sense. Know your enemy's schedule. So why me? Why do some people sail through spring while others are miserable? Any reason for that?
It's not just random bad luck, though it can feel like it. There are definitely risk factors that make someone more likely to develop pollen allergies.
Like what? Is it genetic?
Very much so. Family history is a big one. If your parents or siblings have allergies, hay fever, asthma, even eczema, your odds go up. A parent with allergic rhinitis significantly increases the chance.
Okay, so I can potentially blame my parents. Good to know.
Huh? Well, it's a contributing factor. Also, having other allergic conditions yourself, like food allergies or especially asthma, makes you more prone to pollen allergies too. There's a strong link there.
Asthma and allergies often go together, huh?
They do. Mm-hmm. And having atopic dermatitis or eczema, that itchy skin condition, is another risk factor. It suggests a certain predisposition in the immune system.
What about just the environment, where you live or work?
Absolutely. High exposure to allergens in general, maybe dust mites or pet dander at home, can play a role. Also, exposure to irritants like cigarette smoke or strong chemical odors might make your airways more sensitive.
And does age matter? Can you suddenly get allergies as an adult?
You can, but typically, pollen allergies develop after you've been exposed for a few seasons. Symptoms often don't show up until maybe age 3 or older. It takes time for the immune system to become sensitized.
So knowing if you have these risk factors, especially family history, is pretty key.
Definitely helped with awareness, yes.
Okay, so let's say the pollen is bothering me right now. What can I do for some quick relief? Are there easy fixes?
Yes, thankfully. Over-the-counter, or OTC, medications are often the first line of defense.
Like popping an allergy pill.
Exactly. Oral antihistamines are probably the most common. We talked about how they block histamine. They help with the sneezing, itching, runny nose, watery eyes.
Maybe not the stuffy nose so much.
Right. They're generally less effective for congestion. And you mentioned drowsiness earlier.
Yeah, some knock me up.
The newer ones, the second-generation antihistamines like loratadine, cetirizine, fexofenadine, levocetirizine, they're designed to be less drowsy. But the older ones, like diphenhydramine or chlorpheniramine, can definitely cause sleepiness. Always read the label.
Good advice. Especially checking ingredients and dosage, particularly for kids. Okay, pills help with general symptoms. What else is there? OTC.
Nasal corticosteroid sprays are a really effective option, often considered the most effective for many people.
Steroid sprays, like Flonase or Nasacort.
Exactly. Fluodesimano, budesonide, triamcinolone, and mobisone are the ingredients. They work by reducing inflammation inside your nose. Great for stuffiness, runny nose, itching, and they can even help eye symptoms a bit.
Do they work instantly?
Not usually. That's the catch. They take time to build up. Their effect could be days, sometimes a week or two of consistent daily use. So the best bet is often starting them before your pollen season hits.
Planning ahead again. Okay. What if my nose is just completely blocked? Like, can't breathe at all?
That's where decongestants might come in handy temporarily. They work by narrowing the blood vessels in your nasal passages.
Pills or sprays?
Both. Oral ones contain pseudoephedrine or phenylephrine, sometimes combined with an antihistamine. Nasal sprays have things like phenylephrine hydrochloride or oxymetazoline.
But I feel like there's a but coming.
There is. Oral decongestants can have side effects, raise blood pressure, cause insomnia, nervousness, headaches. People with high blood pressure or heart issues need to be cautious. And the nasal sprays. Big warning. Don't use them for more than a few days in a row.
Why not?
You can get something called rebound congestion. Your nose actually becomes more stuffed up when you stop using the spray, making you want to use it again. It's a vicious cycle.
Yikes. Okay. Limit the decongestant sprays. What about eyes? My eyes get so itchy and watery.
Antihistamine eye drops are fantastic for that. They provide pretty rapid relief from itching, redness, watering, swelling. Look for ingredients like olopatadine or ketotifen.
Any tricks for using them?
A good tip is to keep them in the refrigerator. That cold drop feels extra soothing when your eyes are irritated.
Ooh, I like that idea. Cold eye drops. Anything else from the pharmacy, Al?
There's also a nasal spray called cremolin sodium. It works differently. It stabilizes those mast cells to prevent them from releasing histamine and other chemicals in the first place.
Does it work well?
It can, but it's most effective if started before pollen exposure, and you need to use it frequently, maybe 4 to 6 times a day. So it takes commitment. It's also available as prescription eye drops.
Lots of OTC options. What about stuff I can do at home, maybe without meds?
Definitely. Home remedies can make a big difference. Nasal saline rinses or irrigation are really helpful.
Like using a neti pot.
Exactly. Neti pots, saline sprays, squeeze bottles, they all help flush out mucus and allergens trapped in your nasal passages.
Does it matter what kind of water I use?
Yes. Critically important. Always use distilled, sterile, or previously boiled and cooled water. Never tap water directly, as it can contain potentially harmful organisms. But you can do the rinse as often as needed.
Okay, sterile water only for nose rinsing. Got it. So besides treating symptoms, how do I just avoid the pollen? Create a safe zone.
Avoidance is huge. Reducing your exposure is a cornerstone of managing allergies.
Makes sense. How do I do that when pollen is literally everywhere outside?
True, but you can minimize it. Try to stay indoors on dry, windy days. That's when pollen travels best. Yeah, the best time for outdoor activities is often right after a good rain, which washes pollen out of the air temporarily.
Okay, so maybe schedule my run for after a shower.
Could be a good strategy.
Yeah.
Also, pollen counts are often highest in the early morning, so maybe avoid being outside then if you can.
And checking those pollen forecasts we talked about.
Absolutely. Local news, weather apps, websites like the National Allergy Bureau, NAB. Stay informed. If counts are high, maybe reschedule that picnic. And consider wearing a mask outdoors on high pollen days, especially if doing yard work.
A mask for pollen, like the ones we got used to.
Yeah, even a simple mask can filter out some of those larger pollen particles.
Okay, good tips for outside. How do I stop dragging it all inside with me?
Key question. Keep windows and doors shut, especially during peak pollen times and at night. Use air conditioning in your house and car.
AC helps filter.
It can, especially if you have good filters and change them regularly. In the car, use the recirculate setting on the AC to avoid pulling in outside air laden with pollen.
Right, recirculate button. Got it. But pollen probably gets in anyway, right? On clothes, pets?
It does. So maintaining an allergy-friendly home environment helps. Vacuum frequently once or twice a week, ideally with a vacuum that has a HEPA filter.
HEPA filter traps small particles.
Exactly. Wash your bedding sheets, pillowcases, blankets weekly in hot water, at least 130 degrees Fahrenheit, and dry on a hot setting. This kills dust mites and washes away pollen.
Hot wash for bedding. Check.
Consider using allergen-proof covers on mattresses, box springs, and pillows. They create a physical barrier.
Okay. What about the air inside? Humidity.
Keep indoor humidity low, ideally between 30 and 50%. High humidity encourages mold and dust mites. Use dehumidifiers or your AC.
And don't hang laundry outside to dry.
Correct. Pollen can stick to damp clothes drying on the line.
Never thought of that. Anything else for when I come inside?
Yes. Shower and change your clothes after spending significant time outdoors. This washes pollen off your skin and hair so you don't track it all over the house, especially into your bedroom.
Shower immediately. Good habit to get into. What about air purifiers? Do they actually work?
Ones with a true HEPA filter can be beneficial, especially in the bedroom. They capture airborne particles like pollen, dust, and pet dander.
What should I look for in one?
Check the C80R clean air delivery rate to make sure it's rated for the size of your room. And definitely avoid air purifiers that generate ozone, as ozone is a lung irritant.
HEPA, yes. Ozone, no. Got it. Okay, so that covers immediate release and avoidance. What if that's still not enough? What are the longer term or stronger options?
Persistent or severe allergies that aren't well controlled by OTC meds and avoidance, there are prescription treatments and therapies to consider.
Like stronger versions of the OTC stuff?
Sometimes. There are prescription-strength antihistamine nasal sprays like gazelastine or olopatadine, and even combination sprays that have both an antihistamine and a steroid.
2 in 1, huh?
Yep. There are also prescription pills called leukotriene modifiers, like montelukast. They block different inflammatory chemicals and can be helpful for both allergic rhinitis and allergy-induced asthma.
Okay, so more potent meds from the doctor than there are allergy shots. Are those still a thing?
Oh, absolutely. Allergen immunotherapy or allergy shots is a well-established long-term treatment.
How do they work? Sounds intense.
The goal is to desensitize your body to specific allergens. You get regular injections with gradually increasing doses of the things you're allergic to, like specific pollens. Over time, usually 3 to 5 years, your immune system learns to tolerate them better.
3 to 5 years, wow.
It's a commitment. There's an initial build-up phase, maybe weekly shots for a few months, then a maintenance phase with less frequent shots, perhaps monthly.
Does it provide lasting relief?
For many people, yes. It can significantly reduce symptoms long-term, decrease the need for medication, and in children it might even help prevent the development of new allergies or asthma. It's often recommended when symptoms are severe or meds cause side effects.
So it's like retraining your immune system. Is there anything less needly?
Yes. There's also sublingual immunotherapy, or SLIT. These are tablets that dissolve under your tongue.
Tablets instead of shots. Tell me more.
They contain small amounts of specific allergens, similar to shots. You take them daily at home, usually after the first dose is given under supervision at the doctor's office.
What allergies do they treat?
Currently in the U.S., SLIT tablets are available for certain grass pollens, ragweed, and dust mites. It's a great needle-free option for those specific allergies.
That sounds way more convenient. Okay, so prescription meds, shots, tablets. Are there other things people try? Like, I hear weird stuff about food sometimes.
Yes. You're probably thinking of pollen food allergy syndrome or oral allergy syndrome.
What's that about?
It's when your mouth gets itchy or tingly after eating certain raw fruits, vegetables, or nuts. It happens because the proteins in those foods are structurally similar to certain pollens your body is already allergic to. Your immune system gets confused.
So, like, if I'm allergic to birch trees, an apple might make my mouth itch.
Exactly. Birch pollen is linked to reactions with apples, cherries, pears, almonds, celery, carrots. Ragweed allergy might cross-react with bananas, melons, zucchini.
Wow. Does cooking the food help?
Often, yes. Cooking usually breaks down those proteins so the reaction doesn't happen. Just being aware of it helps people manage it by avoiding the raw trigger foods.
Good to know. What about changing your whole diet? Can eating certain things help allergies?
There's some thought that an anti-inflammatory diet, rich in fruits, veggies, whole grains, lean protein, healthy fats like omega-3s, might support overall immune health. Limiting processed foods, sugar, unhealthy fats is generally good advice anyway.
Any specific foods?
Some foods like ginger, turmeric, things high in vitamin C are sometimes mentioned for potential anti-inflammatory or even mild antihistamine effects. But it's more about overall dietary pattern than a specific cure. It's supportive, not a direct treatment.
Makes sense. And supplements. People are always pushing supplements.
Yeah, the evidence there is often pretty limited or needs more research. Butterbur extract, the PA-free kind, has shown some promise in studies, but more is needed. Spirulina, quercetin, vitamin C, they get mentioned, but the scientific backing for allergy relief isn't super strong.
So talk to a doctor before loading up on supplements.
Definitely. Always discuss supplements with your healthcare provider, especially because they can interact with other medications or have side effects.
Okay. Now the big one, local honey. Does eating local honey actually cure local pollen allergies? Please say yes.
I wish I could give you a definitive yes, but it's largely considered a myth.
Oh, really? Why not?
Well, the theory is you expose yourself to local pollen in the honey. But the pollen in honey is mostly from flowers that bees visit, which are typically not the wind-pollinated trees, grasses, and weeds that cause most seasonal allergies.
Oh, right. Different kind of pollen.
Exactly. Plus, the amount and type of pollen in honey is highly variable and not standardized. Research studies have generally found little to no benefit, or the results are mixed and inconclusive.
So, enjoying local honey is fine, but don't expect it to fix your hay fever.
Pretty much. It might have other benefits, maybe soothing a cough, but it's not a replacement for proven allergy treatments.
Okay, myth busted. So, back to pollen counts and weather. How much attention should I pay to those daily numbers?
Staying informed about local pollen forecasts is definitely helpful for planning. As we said, levels fluctuate, often peaking in the morning.
And rain. We touched on this. It helps, then hurts.
It's complicated. Rain can initially wash pollen from the air, providing temporary relief. But heavy rain can also break pollen grains into smaller, more easily inhaled fragments, which can actually worsen symptoms for some people shortly after the rain stops.
Oh, great.
And thunderstorms are notorious for thunderstorm asthma or worsening allergies, potentially by rupturing pollen grains and dispersing tiny allergenic particles widely with the gusty winds.
So rain isn't necessarily my friend after all.
It's a mixed blessing. The key takeaway is still to be cautious on high pollen days, windy days, and even after storms. Take those precautions we discussed. Stay in, windows closed, AC on, maybe a mask, shower after coming inside, take meds proactively. Maybe put off mowing the lawn.
Good reminders. So with all these strategies, when does it make sense to stop self-treating and actually go see a doctor or an allergist?
Good question. Definitely consult a healthcare provider if your over-the-counter treatments just aren't cutting it, or if they're causing side effects that bother you.
Okay.
Also, if you have other conditions that might be tangled up with your allergies like asthma, frequent sinus infections, or nasal polyps, and the allergies seem to be making them worse, that warrants a doctor visit.
And if it's just...
Yes,
severing. If your symptoms are persistent, severe, and significantly impacting your daily life, sleep, work, or school, it's time to see a specialist, an allergist.
What will an allergist do differently?
They can perform specific allergy testing, either skin prick tests or blood tests, to pinpoint exactly what you're allergic to. Why is knowing the specific pollen important?
It allows for targeted avoidance advice and helps tailor the treatment plan. It's also necessary if you're considering allergen immunotherapy, like the shots or tablets, because those are specific to your triggers.
Ah, right. And they can help manage the related stuff too, like asthma.
Absolutely. Allergists are experts at managing interconnected conditions, like allergic asthma or the increased risk of sinusitis and ear infections that can come with hay fever. Getting that integrated management is key.
So don't just suffer through severe allergies. Professional help is available.
Definitely. There are effective ways to manage it.
Wow, okay. We've covered a lot of ground here, from sneezes to shots to showering. To wrap things up, what's the main takeaway message?
I think the biggest thing is that managing pollen allergies effectively is usually a combination approach. It's about reducing your exposure to pollen as much as possible, using the right medications, whether OTC or prescription when you need them, and for some people, considering those longer-term treatments like immunotherapy.
And knowing what you're actually dealing with, not confusing it with a cold.
Exactly. Understanding the differences is important. And also being realistic about complementary approaches. Some might offer support, but things like local honey aren't proven cures. Staying informed about pollen levels and weather impacts helps too.
It really empowers you to take control, doesn't it?
It does. And remembering that if things are rough, professional medical advice and allergy testing can make a huge difference in finding a personalized plan that works.
So, final thought for everyone listening. Now that you've got this deeper understanding of pollen allergies and all the ways to tackle them, maybe think about one or two small adjustments you could make. What might help you navigate the next allergy season feeling a bit better, with a bit less misery?